This is Toby. Oh, hi, Liz. You want to set up an eval? Okay. When do you want to do it? Wednesday? 1 o'clock? Okay, I can do that. What's his name? Matt? Age? 22? What's the diagnosis? Oh, quadriplegia? Okay. The accident happened how long ago? 2 months? Are they doing any renovations? They're putting a ramp in, and then they're going to transport the chair. How? Oh, we're going to need a backup as well. All right. Anything else? Will any of the family be there? Okay. And the funding. Terrific. Okay. I'll see you on Wednesday, 1 o'clock. Thank you.
This client has a challenge: to maintain his independence. The solution? Effective and safe mobility and positioning. Effective and safe mobility and positioning solutions do not sit on a shelf or come out of a box. It's a team effort that involves a variety of people from different disciplines with different skill sets. These specialists work with the client to achieve the best outcome by looking at the individual's short-term needs and long-term goals.
I've got his upper.
Got him?
I got your man.
Okay.
What kind of chair have you been using as a patient? Have you been pushing one, or have you been using a power chair?
I've been using a power chair,
Power chair?
and I've been using a goalpost to help steer.
Okay, so the thing you're setting your hands in.
Yeah, I rest my hand at it.
Okay. Any problems with any of that?
No,
Okay.
that seems to work well.
Have you been getting dizzy?
Yeah.
Have you had problems with your blood pressure dropping?
Yeah.
How often? Is it every day? Is it every time you get up?
No, it's usually when I first get up in the chair, and
Okay.
sometimes intermittently during the day.
Matt, are we tilting or reclining?
Tilting.
You're tilting, so you know the
Yeah.
difference between tilt and recline.
Yeah.
Which hand are you driving with?
My left.
Left. Okay. And you want to maintain the left hand?
Yeah.
Okay.
It sounds like a cliche when people say your life can change in an instant, but it does, and then I'm left with having to figure out how do I deal, what do I do. I definitely got in my share of trouble. I was a handful for my mom and dad to raise. I was always doing stuff. I played sports, skateboarded, guitar. I was always busy. Always had to be doing something. And I think I was pretty typical, pretty normal kid. Didn't like school, but I knew that it was something that I should do because that's where the money was. If I wanted to make money, I had to go to school. If I wanted something, my parents taught me that I had to work for it to get it. I definitely think I had a normal childhood. I was on my way to work when I got into my accident. I was seated in traffic. I was stopped for an accident ahead of me. A tractor trailer hit me from behind and pushed me into another tractor trailer in front of me. And I was passed out for maybe a minute, and I remember the whole thing. I remember the firefighters sawing the door off, sawing part of the steering wheel off, talking to me the whole time. I remember getting taken out of my car and put in the ambulance. I remember being in the emergency room. I remember my first surgery. It was horrible. I wanted to die. I couldn't move. I had this tube down my throat. I had a machine breathing for me. I couldn't feel anything. I kept asking everybody to touch my hands because they'd touch my face, and because that's where I could feel. I'd say, no, touch my hands. I want to see if I could feel that. It was just really horrible because I was completely at everybody else's mercy. I was completely dependent on other people.
His ankle range is really good, and his knee's straight, so I predict that it's fine. He's got at least 10 degrees.
77.
Many clients who need custom mobility, positioning, or other adaptive equipment, whether 18 months or 90 years old, or anywhere in between, are faced with extreme and often sudden stress in their lives.
Well, the process of providing customized or rehab seating and mobility is very complex. And if you don't have that face-to-face evaluation, it's really impossible to determine what all the problems are with the client, and knowing what the home environment is and knowing what the transportation system that the client is using is. All of those elements are critical to really determining what the appropriate equipment choices are. And if you don't do the face-to-face evaluation, then you are running a very high risk of not providing appropriate equipment to the person, and then you're going to cause problems if you don't provide appropriate equipment.
An element of the evaluation process is the technology assessment, which is the matching of the mobility and seating equipment to the client's needs. The technology assessment should be performed by a qualified rehab technology supplier. The qualifications of the rehab technology supplier are as important as the qualifications of any other allied health professional. Selecting the correct rehab technology supplier is as critical as selecting a qualified cardiologist or oncologist.
Well, certainly anybody with a progressive disease process, or even somebody who has a neuromotor disease that affects them as a child, such as someone with cerebral palsy, they will have postural problems related to abnormal muscle tone or muscle weakness. And if your postural support system does not provide them with adequate support in their wheelchair, then they stand a very high potential for developing further problems, either joint contractures because they weren't supported in a good position, or their actual postural deformities such as a scoliosis in their trunk or an abnormal pelvic tilt or something like that. May very easily progress, and then that will cause the person to have other problems like respiratory function impairments or digestive system impairments, and those can be very, very dangerous and in some cases even life